Good evening. My name is Anilda and I'll be your nurse today. How are you today?
Good.
Okay. What is your name?
Alinda.
Linda. Okay. Let me wash my hands. I will wash my hands. I will shut the curtain. Can you please verify your name and your date of birth for me?
Alinda Cooper and October 21st.
Okay. How are you today?
Good.
Okay. What brings you here today?
Just remind now my routine.
When was the last time you had a routine physical?
6 months ago. A year ago, actually.
When was the last time you had your routine physical?
1 year ago.
Okay. Was everything okay with the physical?
Yeah.
All right. Do you have a regular eye doctor? I mean, regular primary doctor that you see?
Yes.
What is the name of your doctor?
Professor McGonagall.
McGonagall. Okay. Do you have any past history? Do you have a history of heart disease?
No.
Do you have a history of hypertension? Do you have a history of the coronary disease?
Yeah.
Do you have a history of pulmonic disease?
No.
Any lung disease?
No.
Do you have any history of asthma?
No.
Do you have any history of gastrointestinal disease,
No.
such as Crohn's disease?
No.
Do you have any history of diabetes?
No.
Do you have any chronic illness like diabetes, hypertension, high cholesterol?
No.
Do you have any psychiatric illness such as depression, anxiety, bipolar?
No.
Okay. How about any infection disease like pneumonia, stomach infection?
No.
Do you have any allergy to food?
No.
Do you have any allergy to medication?
Yeah.
Do you have any allergy to latex?
No.
Do you take any medication for any pain, anything?
No.
Do you take any over-the-counter medication?
No.
When you do you have like a headache?
No.
When you do have pain or any headache, do you take any medication to manage it?
No.
What how do you control your pain?
Take a nap.
Okay. But sometimes like if taking a nap doesn't relieve, it's better to control. You can either have like a over the counter medication, call your doctor and let your doctor know so it can prescribe something that fits your age. Okay. Do you have any history of fracture that you needed to be hospitalized?
No.
Okay. Did you have any history, any surgery at all?
No.
Any surgeries that requires for you to have an requires for them to put you to sleep?
No.
Okay. Is your childhood vaccination all up to date?
Yes.
Okay. Do you take flu shots every year?
Mhm.
Okay. When was the last time you had a hepatitis B, tetanus? The last time you had the hepatitis and the tetanus?
1 year ago.
Okay. So which one do you prefer? Do you prefer a man or a woman? Okay, resuming. What is your sexual preference?
Man.
Okay. Do you have any past history of infections?
No.
Family history. Your grandparents, are they still alive?
Yes.
Okay, so Megan. Okay. Is your grandparents still alive?
Yes.
Do they have any um any health problems?
No.
Is your grandfather healthy?
Yes.
Okay. How old is your grandfather?
60. See.
Okay. And how?
No, 53.
Okay. Is your that's your grandfather from your mother's side or your father's side?
My father's side.
Okay. And your grandmother from your father's side, is she's still alive?
Yes.
Okay. Does she have any health issue?
No.
Okay. Is your grandmother from your mother's side does she have any health problems?
No.
Is your grandfather from your mother's side have any problems?
No.
Okay. How many brothers and sisters do you have?
I have 10.
10.
Yes.
Okay. Are they all alive?
Yes.
Do they have any health problems?
No.
And what is the oldest siblings that you have?
Me and my brother.
So how old is the older?
Oh, the oldest is 10.
Okay, and the youngest is?
It's 1.
Okay. Is your mother still alive?
Yes.
Does she have any health problems?
No.
Is your father have any health problems?
No.
Okay. How old are they?
My mother's 30, my father's 33.
Okay. So who do you live with?
My mother.
Do you see your father?
Yes, every Saturday.
Is he involved in your life?
Yes.
Do you have any family history of blindness or deafness?
No.
Coronary cardiovascular disease,
No.
such as heart attack, pulmonary emphysema,
No.
colon cancer,
No.
gastrourinary kidney disease,
No.
endocrine thyroid problems,
No.
muscular dystrophy,
No.
neurological spinal bifida, or brain injury.
No.
Do you have any family history of obesity?
No.
Any family history of cancer of any part of their body, such as lung, heart, abdominal?
No.
Bleeding disorder like hemophilia?
No.
Mental disorder like schizophrenic?
No.
Anxiety?
No.
Depression?
No.
Any family history of genetic disorders such as cystic fibrosis?
No.
Any family history of abuse,
No.
substance abuse such as alcohol or drugs? Any family history of allergy to medication?
No.
Okay. What is your place of birth? Where were you
Boston.
born?
Boston Hospital.
Okay, Boston Hospital. Boston Hospital. Okay. What is your nationality?
Woman.
What is your nationality?
Excuse me, I need something to quick.
What is your nationality?
Black.
African American?
Mm-hmm.
What is your ethnicity?
Black.
What is your marriage status?
Good. Single.
Okay. Do you work or you go to school?
I go to school.
Go to school. Okay. Do you live in an apartment or a home?
At home.
A home. Is it rented or is it owned?
It's owned.
How many times a day do you eat?
3 times breakfast, lunch, dinner with snacks between.
Okay. Do you eat most meat, chicken, or pasta?
No.
What do you most eat? How's your diet?
Good. Fruit salad all day, every day.
No, you need to balance your diet with meat, chicken, and pasta so you can vegetables.
Yeah.
Okay. Do you drink water every day?
Yes. A gallon of water makes your skin clear, I think.
Oh, that's very good. I'm glad you know that. Okay. Do you exercise?
Yes.
How many times a week do you exercise?
Once.
Once a week?
Yes.
Oh well, it will be better if you do it like twice or 3 times a week.
Mm-hmm.
Okay. Do you drink coffee?
No.
That's good. Do you smoke?
No.
Are you exposed to secondhand smoke?
No.
Do you drink alcohol?
No.
Okay. How many hours do you sleep a day?
8 hours.
Yeah. Do you take a nap in between?
Yes.
How many hours a nap you take?
2 hours and a half.
Okay. What do you do for fun? Any hobbies?
Boxing.
Okay. Okay. Do you use any alternative health care practice such as acupuncture?
No.
Do you own a gun?
No.
Do you know somebody that owns a gun?
No.
Okay. Do you wear seatbelts at all time?
Yes.
Have you been involved in any domestic violence?
No.
Okay. Do you have any fever, chills?
No.
Any recent weight loss?
Yes.
How many pounds did you lose?
5 pounds.
Okay. Did you lose it because you wanted to lose, or is it related to any health problems?
That's because I wanted to.
To lose. Okay. Do you feel fatigue?
Yeah.
Fatigue. Weak.
No.
Um. So recently, did you have any vision problems such as blurry vision?
No.
Do you use eyeglasses?
No.
When was the last time you had an eye exam?
Last year.
Last year? It's better for you to do every 6 months. It's good. It's recommended to do every 6 months. Okay. In your ears, any recent change such as difficulty hearing, pain, or any discharge, any drainage in your ear?
No.
Your nose, do you have any difficulty smelling, runny nose, cough?
No.
No. Do you have any problems swallowing, difficulty eating or chewing food?
No.
Any mouth sore or vision in the mouth? And alas, any mouth sore or lesion in your mouth?
No.
When was the last time you had a dental exam?
6 months ago.
Do you feel any chest pain?
No.
Abnormal heartbeat, such as like shortness of breath?
No.
Okay. Any difficulty breathing or coughing?
No.
Do you have any recent like diarrhea or constipation?
No.
Blood in the stool?
No.
Okay. Do you have any muscle pain, problems with the range of motion or movement of your extremities, such as like when you move your hands up and down, when you're walking?
No.
Okay. Any recent rash, lesion, or nodule?
No.
No. You have any psychiatric issue like depression, anxiety, sleeping problem?
No.
Okay. Any hot or cold, abnormal hair loss?
No.
Do you bruise easily?
No.
Like when you have a cut, does it last longer than usual? Do you have it when you brush your teeth? Do you have like any bleeding in your gums?
No.
Do you have like any allergy to grass, pets, or pollen?
No.
Alright, so I'm done with asking questions. So I will start doing some assessment. Like I'll be touching you, um, and I will ask you to do some things for me to make it easier for my assessment, such as um breathe, inhale, exhale. But I will walk you through every step of the way when I do it. Okay. Okay, so first I have to inspect. Can you just breathe normally? You don't have to lay down. Okay? You just have to breathe normally. I have to inspect your skin. Can you just sit down facing this way for me, please? Sideways? That's okay. This is okay. Okay, so the patient is physical appearance is great, well nourished. Feel skin is symmetric. No labor pain noted. Skin warm to dry, normal to ethnicity. No signs of bruise or scar. Okay. Alright. The patient is breathing normal with clear appearance and no odor. Huh? Alright, so patient is breathing normal, no labor breathing. Breath is good and clear, no odor identified, no observation of difficult mobility such as sitting to the chair, and patient asks all the questions appropriately. Patient is alert and oriented. Finally, there is no signs of distress. As of right now, I'm gonna have you. Can you please stand up and step into the scale? So as of right now, I have to weigh my patient. Do the height and weight. Okay, so patient weighs 100 pounds, and the height is 5'2". The body mass is according to her age, and you can have a seat, please. According to her age and her according to her age, and then I'm gonna measure your blood pressure. I forgot to get the blood pressure. Okay. So if I had my blood pressure, I would wrap it around your arm. Okay. And then I would just do the pulse and check it. All right. Patient blood pressure is okay. her pulse ox is 92. Her rate is 110/78. Respiration 18. Heart rate 78. And temp is 97.7. Okay. Alright, so now I have to after do the inspect, I have to palpate. Okay. I have to check sure the head shape, the hair is symmetric, the hair is evenly distributed. Okay, so I have to palpate the lymph node on the back of the ear, and then I go down. Okay. Can you swallow for me? Swallow. Okay. Can you just step under your arm? Right. Are you having any abdominal pain?
No.
Can you hold my fingers, my hands? Can you squeeze it? Okay, there you go. Let me see. Don't let me, I will push it down, but you gotta hold it, okay? Don't let me, okay. Alright. Just do the motion, range of motion. Can you put your hands up and down? Okay, that's fine for me. Alright, can you smile? Okay, alright, you can do it normal, that's fine. Just your ears. Okay, so I have to do the Snelling chart. My patient will be standing 20 feet from the chart and will ask my patient to read the lowest number. Okay, so I will ask you to read the lowest number. Okay, you're standing like 20 feet. And then, let me see, I have it here. Can you read the lowest number over here? The lowest letter? Read back to me.
A R D C.
Okay, perfectly fine. Can you cover your left eye? And can you read the second lower number?
I L A D.
Okay, that's okay. Can you cover your right eye?
B C S Z B.
Okay, so patient vision is 20/20. Okay, upon inspection on patient's face, neck, and head, I see symmetric, no edema, no facial drooping, and the eyes are at the same level. Okay. And then upon palpation, the head for any abnormal depression, if infestation or baldness, check the beard at the same. I see even hair distributed, no scalp lesion. The temporal artery is both a finger 2+. I palpated the TMJ, open close mouth. Can you please open and close your mouth? Okay. I palpate the clothing and the open of the mouth.